Introduction: Partnering in your care to improve your treatment experience. This presentation will go over basic information about chemotherapy and biotherapy, as well as reviewing how to be an active partner in managing your treatment experience. We will be covering many resources that you can use to help manage possible side effects while getting chemotherapy. Please keep in mind that treatment is tailored to your specific diagnosis. Thus, each person will experience possible side effects differently. Some of the side effects we will be reviewing may not apply to your specific treatment, but the most important message we want to share is that the side effects are manageable. We will begin this presentation by learning about what is the difference between chemotherapy and biotherapy, how each is given, and why these treatments cause side effects. Also, we will review common side effects and how to manage them. Knowing this information will hopefully ease some of your fears and will give you the tools to help you get through your treatment. We will not be covering specific drug information. You will get drug-specific information from your infusion nurses, your nurse practitioner and/or doctor. Remember to ask questions and request more information should you need it to feel better prepared. What is chemotherapy? The term chemotherapy refers to the use of chemical drugs to fight rapidly growing cancer cells. Chemotherapy is a systemic treatment, which means it enters the bloodstream and travels throughout your whole body. You may get chemotherapy alone or in combination with localized treatment that treats a very specific part of your body, such as radiation, surgery, and biotherapy. Chemotherapy can be given in a variety of different ways. Usually, chemotherapy may be given through pills you take by mouth, an injection or IV, intravenously, directly into the bloodstream. For some specific cancers, a special device can be placed onto the surface of the abdomen or head to give you chemotherapy. Chemotherapy is usually given in cycles. A cycle means that you will get chemotherapy for a period of time followed by recovery time. An example would be a 28-day cycle where you get treatment weekly for 3 weeks. Then the 4th week is your rest period. Your next, cycle 2, would be the same for the next 28 days. The number of cycles of chemotherapy you get depends on the specific cancer being treated and treatment plan. Cycles are helpful in allowing the body to recover from the chemotherapy and any side effects. Where is chemotherapy given? If you are getting chemotherapy pills, you will be given instructions on how to safely take them at home. If you are getting chemotherapy as an injection, you will get your treatment in one of our outpatient infusion units. Generally, our hematology patients will be treated in Browerman 1D, medical oncology patients in Browerman 3C, patients on clinical trials in CRU, and our transplant patients go to the day hospital. What is a central line? If appropriate, your doctor may recommend getting a central line if you will be getting chemotherapy through your vein. It is a long, thin, flexible tube that is inserted into a large vein in the chest or arm to give you medications or take blood samples when needed. One benefit is that a central line can stay in place over several weeks or months to reduce the amount of times you are pricked for injections. There are 3 different types of central lines. A PICC line, shown in picture number 1, can be used for several months and needs a dressing change weekly or whenever the dressing is soiled. You will also need to protect the line from water when you are showering. A Hickman catheter, shown in picture 2, also requires a weekly dressing change. A portacath, shown in picture 3, is placed just under the skin. We use a special needle to access the port, but the needle can be removed after each treatment, and there is no required dressing change, and you don't have to worry about protecting it from water since it is placed just under your skin. You will get treatments in one of the infusion units mentioned in the previous slide. If you need blood drawn, lab appointments will be scheduled in the VAD room located in Maine Medical, where a registered nurse would draw your blood. Why does chemotherapy cause side effects? Chemotherapy is good at destroying rapidly growing cancer cells, but this treatment will also destroy your good cells in the process. For example, normal body cells that grow rapidly are hair follicles, skin cells, and cells lining your mouth, esophagus, stomach, and intestines. Chemotherapy cannot tell the difference between cancer cells and your normal cells. However, it is important to remember that not every person who gets cancer treatment will have side effects, and the same treatment can produce different side effects in patients. Your experience may be completely different than other patients getting the same treatment. Chemotherapy side effects: how to manage symptoms before and after treatment. It is encouraging to know that some side effects go away fairly quickly after treatment ends, and others may take months or years to disappear completely. Treating your side effects when the symptoms are mild will help keep them under control, so it is important that you report any side effects you may be experiencing. There are many ways to manage and control your side effects. Many of these are found on your symptom management cards, where you will find important information about the symptom, how to manage the specific symptom, and when to call the nurse or doctor. These cards can be found in the outside pocket of the new patient blue packet. You can also get them from the infusion units and at the Sherry and Les Biller Patient and Family Resource Center. Most common side effects. Listed are the most common side effects. Not every patient gets these side effects, and all of them can be managed. Always report symptoms to your doctor or nurse. Low blood counts, myelosuppression. Your blood cells are some of the good cells that chemotherapy is destroying, while it is also destroying your cancer cells. When this happens, blood counts start to become low, which is a condition known as myelosuppression. If your chemotherapy treatment has the potential to affect your blood cell counts, you will have a lab draw before each treatment to ensure we can safely continue your treatment. Managing anemia, low red blood cells. When you have low blood counts, you may develop anemia. This happens when your blood lacks enough healthy red blood cells. With fewer red blood cells, you feel really tired and weak. You may also feel dizziness and shortness of breath. Ways to manage anemia include: to save your energy, choose the most important things to do each day. Ask for help. When family or friends offer to help, let them. They can take you to the doctor, buy groceries, or make meals. Balance rest with activity. Take short naps during the day between activities. Too much bed rest can make you feel weak. Research has shown that exercise is the best way to manage fatigue. Exercising does not have to include a difficult regimen. What matters is that you just keep moving. This can also help you sleep better, and along with rest breaks can help you feel better. Eat and drink well. Healthy eating and drinking will give you the nutrients you need to feel less fatigue. Anemia symptoms you need to report right away. If you are anemic, you may feel tired and fatigued, cold, dizzy, or lightheaded when you stand up, possibly short of breath, or even a faster heart rate. These symptoms should be reported to your doctor right away to get treatments that will help you feel better, such as getting growth factor shots that will stimulate the production of red blood cells. You may also need blood transfusions. Your lab tests will be able to tell your doctor how low your red blood cell count is to determine what is needed. Call 911 immediately or go to the nearest emergency room if you have chest pain or serious trouble breathing. Let the doctors know in the emergency room that you are a cancer patient and that you have recently received chemotherapy. Managing neutropenia, low white blood cells. When you have low blood counts, you may also develop neutropenia. This happens when your blood lacks enough healthy white blood cells. White blood cells fight infection, and with fewer white blood cells, you are at a higher risk for developing an infection. Immediately after getting chemotherapy, your white blood cell counts can begin to decrease. The first 7 to 10 days is when white blood cell counts can be the lowest. This time period is called a nadir. During your nadir, You are very susceptible to infections. The good news is that there are many simple strategies you can use to help prevent infections. Your doctor may give you medication during your treatment to help your body make more white blood cells. How to protect yourself when your white counts are low. Neutropenia. There are lots of ways to protect yourself from infection when you are neutropenic. The first and simplest strategy is frequent hand washing. This is the #1 way to stop unwarranted bugs, viruses, and other sources of infection. Your whole family should wash their hands to help protect you from infections. Also, you can use hand sanitizers. Do not touch your face unless you have clean hands. If you are feeling feverish, have chills, or unusually sweaty, check your temperature. Report any fever of 100.5. Call your doctor or nurse right away with these symptoms, as they may want to see you and start you on antibiotics. Take special care of your skin to prevent breaks or cuts. Injuries to your skin can allow bacteria to enter into your bloodstream and cause an infection. Stay away from anyone who appears or feels sick. Remember to be extra careful around children, especially those in school or daycare. If for any reason you have to be around children, make sure they wash their hands and that you wear a mask and wash your hands often. It is helpful to minimize your time with small children and large crowds as much as possible during your nadir. Be aware of sniffles, coughing, and runny noses in those around you. You can keep masks and hand sanitizers with you when you are out of your house. Reporting signs and symptoms of infection. Tell your doctor or nurse right away if you have any of the following signs and symptoms of infection. Temperature greater than 100.5 degrees Fahrenheit. New cough, which may or may not have mucus. Shortness of breath. Burning or pain when you urinate. Red, swollen, or draining IV catheter site. Sores or white patches in the mouth. Diarrhea lasting more than 24 hours. Shaking chills or body aches. Skin sores that are not healing. It is important to report these symptoms, especially if you have received chemotherapy in the past 2 weeks. Managing thrombocytopenia, low platelet cell count. Thrombocytopenia happens when your blood lacks enough healthy platelets, which are the cells that clot your blood. Low platelets can put you at risk of bleeding and bruising more easily. You want to avoid injury from slips and falls because serious injury can occur from bleeding. Check your home for potential dangers, including moving simple things such as rugs that can trip you. Be extra careful with how you take care of your mouth. Use soft toothbrushes and don't floss or use toothpicks. A small injury to the mouth or gums can set up both bleeding and infection. Avoid straight razors while your platelet blood cells are low. Check with your doctor before taking aspirin or other pain relievers, which may put you at even more risk of bleeding. Thrombocytopenia, symptoms you need to report right away. Call your doctor to report skin changes, including bruises or tiny red pinpoint spots on your skin, changes in your vision, bad headaches, feeling confused or very sleepy, bleeding that doesn't stop after a few minutes, blood in your urine. The urine will have a red or pink color to it, black or bloody stools. Gastrointestinal side effects, nausea and vomiting. Nausea and vomiting are common side effects of chemotherapy, but in most cases, it can be controlled with medication and does not occur with every person or with every treatment. Medications are usually given before and after treatment to control nausea and vomiting. If your treatment is known to cause nausea, then you will get nausea medication before you begin treatment. These medications can be given as pills or directly through your vein. You may also be given medication to take as needed or scheduled daily for a couple of days following your treatment. Be sure to take your nausea medication when needed. And if you are still having nausea or vomiting while taking your medication, Be sure to report this because there are other medications we can give you. Preventing and managing nausea and vomiting. There are steps you can take to prevent and manage nausea and vomiting. Try to avoid nausea and vomiting by taking your nausea medications on time. If you feel nauseated, then take your nausea medications on time for the first 2 to 3 days after chemo, meaning if your medication says every 8 hours or every 6 hours, then you take it every 8 or 6 hours. After the first 48 hours, if you are feeling better, then you can stop. But if you still feel nauseated, continue taking your medication as instructed. Eat foods and drink beverages that are easy on the stomach, such as ginger ale, bland foods, dry crackers, or toast. Take your medication before you eat, and do not force yourself to eat when you feel nauseated. Limit drinking fluids when you are eating. Eat food cold or at room temperature. It is very important to tell your doctor if your nausea and vomiting is not relieved. Diarrhea may occur. Diarrhea is the passage of loose or watery stools 3 or more times a day with or without discomfort. Uncontrolled diarrhea can lead to loss of fluids and electrolytes. Diarrhea caused by chemotherapy or radiation therapy may last for up to 3 weeks after treatment ends. It is a very common side effect with some chemotherapy and biotherapy treatments. If diarrhea or abdominal cramping begins during treatment, you will be given medication and will be instructed on the use of over-the-counter medication. What you can do to manage diarrhea. When you begin experiencing diarrhea, you can take action by changing what you eat and drink, including drink clear liquids. As soon as your diarrhea starts, switch to a diet of clear liquids such as water, apple juice, clear broth, and ice pops. Avoid milk products as lactose intolerance may contribute to diarrhea. Eat low-fiber foods. As your diarrhea starts to improve, add foods low in fiber to your diet such as bananas, rice, applesauce, and toast. Eat frequent and small meals. Eat foods high in potassium. Potassium is an important mineral that you can lose through diarrhea. Try eating bananas, potatoes, and apricots to boost your potassium levels. If you have kidney problems, consult with your doctor before eating foods high in potassium. Avoid foods that can irritate your digestive tract. These include dairy products, spicy foods, alcohol, caffeine, and foods high in fiber or fat. If changes to your diet aren't relieving your diarrhea, your doctor may give you medication to offer relief. Let your doctor or nurse know right away. Diarrhea can lead to other problems, such as severe dehydration. Diarrhea, symptoms you need to report right away. Call your doctor or nurse if you have 4 or more watery bowel movements a day for more than 2 days, blood in your stool, unable to urinate for 12 hours or more, unable to drink any liquids for more than 2 days, lose 5 pounds or more after diarrhea starts, have a fever with a temperature of 100.5 degrees Fahrenheit, feel severe abdominal pain, suddenly have a puffy or bloated abdomen, sore mouth and throat changes. The key to managing sore throat or throat changes is to prevent it from happening. It is a good idea to try and visit your dentist at least 2 weeks before starting treatment. Also, it is a good idea to look in your mouth so that you have an idea of the appearance before chemotherapy and biotherapy. This will help you to identify any new white patches or changes in your mouth. Be sure to tell your dentist you are being treated with chemotherapy or biotherapy. Some dentists will prefer you to wait or will ask for a note from your cancer doctor. It is important to keep your mouth clean and make sure to rinse your mouth after every meal or at least 4 times a day, morning, noon, evening, and night. Do not use mouthwash with alcohol in it. You can also rinse 3 to 4 times a day with a solution of 1/4 teaspoon baking soda and 1/8 teaspoon of salt in 1 cup of warm water. Tell your doctor or nurse immediately if you notice mouth, gum, or throat sores, especially after your chemotherapy. Feeling fatigue. Fatigue is feeling tired, physically, mentally, and emotionally. Daily, you can feel less energy, unusual or excessive whole body tiredness to do the things you need or want to do, and you feel no relief with sleep. Factors that may contribute to cancer-related fatigue include anemia. When you are anemic from low red blood cell counts, the oxygen-carrying ability, hemoglobin, of the blood lowers as well, resulting in tiredness. Combination therapy. Patients receiving more than one treatment at the same time or one after the other can cause fatigue. Medications used to treat side effects such as nausea, pain, depression, anxiety, and seizures can also contribute to fatigue. Feeling pain can cause you to feel more fatigue. Stress can worsen feelings of fatigue. Depression may also be a factor. Talk to your healthcare team about your worries and concerns. They will be able to help you. Managing fatigue. Remember that normal activities will make you feel tired. For example, showering may take more energy than you realize. Be sure to include rest periods and ask family to help with daily chores. Eat a healthy, balanced diet to help with energy and overall wellness. Plan your activities and organize your work. Remember to pace yourself and schedule rest periods. It is important to exercise. Research has shown that exercise is a good way to manage fatigue and will help you sleep better as well. This is not a time to start a new boot camp training, but you can continue your current exercise. Just remember that you may not be able to keep at the same pace or may have a lower stamina. If you currently don't exercise, walking around the block or short walks are a good way to keep your body moving. It is always best to check with your doctor if you are planning any new activity or have questions about your current activity. It is important to feel like you accomplished your work or activities each day, so be sure and take rest breaks and eat a nutritious diet. Choose the most important activities you want to accomplish and remember to ask for help from others, such as cooking dinner or doing the laundry. Hair loss and chemotherapy. Hair loss, alopecia, can be, but is not always a side effect of chemotherapy. Your doctor or nurse will tell you before you start treatment if you can expect to lose your hair. Hair loss usually begins 2 to 3 weeks after chemotherapy treatment starts. The good news is that your hair will grow back. Hair usually starts to grow back 1 to 2 months after chemotherapy ends. However, it may take 6 months or more for your hair to fully grow back. You may also have thinning or loss of eyebrows, eyelashes, facial hair, chest hair, pubic hair, underarm hair, and arm and leg hair. Managing hair loss. There are several tips you can follow to deal with hair loss. You can get a short haircut before you begin treatment. Shop for a wig before your hair is gone, especially if you wish to match your natural color, or it may be a good time to try a new hair color. Shave your head before your hair starts to fall out. Beside wigs, try other head coverings such as hats, scarves, and turbans. Accessorize with makeup or jewelry. Attend a Look Good, Feel Better class offered at the Sherry and Les Biller Patient and Family Resource Center that teaches makeup and accessorizing techniques to cancer patients. You can also visit or call our Positive Image Center for a consultation with a licensed cosmetologist. The best way to deal with hair loss is to choose what is most comfortable for you. There are no right or wrong ways. Remember, we are here to help. Skin changes. Your skin is one of the areas of your body that is most commonly affected by cancer treatment. You can develop dry, sensitive, and irritated skin. You may develop skin color changes as well as nail changes with some chemotherapy and biotherapy treatments. Some of these changes can occur over time and may not appear until your third, fourth, or even fifth cycle of treatment. Use a good moisturizing lotion daily after your shower, such as Aveeno or Lubriderm. Be sure to report any skin changes to your doctor or nurse. If you have a history of ongoing skin problems such as eczema or psoriasis, let your doctor know so they can have you checked by a dermatologist. Protecting your skin. Protecting your skin from UV rays is very important. Use a broad spectrum SPF 50 sunscreen every day. Keep your skin covered during the daytime, especially your head. Avoid using products that have fragrances, dyes, and preservatives. These ingredients can cause itching and rashes. It is also important to avoid gel and artificial nails, as your nails can become easily damaged. Use moisturizing products daily. Apply right after your shower when your skin is a little moist. When applying your moisturizer, it is important to apply around the nails of your hands and feet. Skin changes to report right away. Let your doctor or nurse know right away if you notice unexplained or worsening skin rash, have itching, pain, or other troubling symptoms with a rash that is affecting the inside of your mouth or nose, have any blistering, peeling, or open areas on your skin, or if you think you have an infection in the skin or nails. A rash could also develop from a dressing we place on your skin, so be sure to notify your doctor or nurse about any irritation or rash that develops from a dressing we place, so we can be sure to change the type of dressing we use on your skin. Chemotherapy neuropathy. Chemotherapy neuropathy means that certain nerves are injured by chemotherapy. It is a common side effect of some chemotherapies and biotherapies. Neuropathy often occurs in the hands, fingers, and feet or toes. Chemoneuropathy can begin any time after your first treatment and can get worse as treatment continues. Common symptoms of neuropathy are pain, tingling like pins and needles, often early signs, numbness and/or weakness, losing your balance, feeling clumsy, tripping and stumbling when walking, feeling more cold than you used to, trouble picking up objects or buttoning your clothes. Managing chemotherapy neuropathy. Like all other symptoms, it's important to tell your doctor or nurse about any numbness or tingling you are having in your hands or feet. If you develop peripheral neuropathy, let your doctor know right away and be sure to ask about any precautions you should take to keep you safe. Letting your doctor or nurse know about early symptoms will ensure we try and keep your neuropathy at a minimum. Also, let your doctor know if you have other conditions such as diabetes, previous chemotherapy, history of alcoholism, or severe malnutrition. Physical intimacy. Intimacy and sexuality are very important aspects of life that fulfill the emotional and physical needs of all human beings. Chemotherapy, biotherapy may affect the way you feel about intimacy and physical closeness. Some issues that may challenge you and your loved one are anxiety about your disease, treatment, or financial concerns, worries about body image changes, physical effects of treatment such as nausea, diarrhea, or skin problems, or depression and fatigue. Some options that may help you are to be open to your partner about your feelings, maintain open communication, talk with your doctor or nurse, hold and be close to each other in other ways to keep intimacy in your relationship. This can be a difficult topic to talk about, but it's very important to know what you can do to continue enjoying physical intimacy. We can also provide you with resources if you prefer to read about ways to handle intimacy issues or questions. Sexuality and fertility changes. Chemotherapy can affect your ability to have children, also called infertility, temporarily or permanently. However, this does not always affect sexual organs and how they work. Discuss your plans of having children with your partner. Talk with your doctor or nurse about your treatment and if it may cause infertility. Also, talk with other members on your healthcare team, such as your clinical social worker, to learn about resources. Other cancer treatments. You may also get biological cancer therapy called biotherapy. This can also be called immunotherapy or targeted therapy. Biotherapy and the immune system. The immune system. The immune system defends against unknown cells such as bacteria, viruses, and cancer cells. It maintains our health by destroying aging or damaged cells and identifies foreign substances. Biological therapy uses materials made by our own body or made in a laboratory to boost, direct, or restore our body's natural defenses against diseases such as cancer. You may have a combination of traditional chemotherapy that is systemic and affects the stage of the cell growth, and also a biotherapy that is a targeting agent. Biotherapy actions. Biotherapy is a smart drug that goes after specific targets or helps your immune system recognize the cancer cell more efficiently. This therapy will directly attack cancer and has other biological effects on the tumor that keeps it from spreading and changes the tumor cell. How is biotherapy given? Biotherapy is given in the same way as chemotherapy, a pill taken by mouth, injection, or infusion. Biotherapy is often given in combination with chemotherapy. Although biotherapy does not attack healthy cells, it still may have side effects. Biotherapy side effects. Although biotherapy doesn't attack healthy cells, it does still have side effects because even when our normal immune system is fighting against a cold or illness, you will have things like chills, rash, or fever. Some possible side effects of biotherapy include skin redness at injection site, vein irritation, flu-like symptoms, fever, chills, body aches, fatigue, nausea, vomiting, or diarrhea, low or high blood pressure, or allergic reactions such as cough, wheezing, or skin rash. Where do I call for help when I'm at home, at night, or on weekends? If you have urgent concerns at night or on weekends, call the triage nurse at 626-471-7133, available 24 hours, 7 days a week. A nurse will answer your questions and help you manage symptoms. If you need medical treatment, you will be asked to come to our Evaluation and Treatment Center, ETC. The ETC is located in the first floor of Browerman Clinic. Your City of Hope resources. Getting chemotherapy will bring about many changes in your life, but you and your family can become well equipped to manage changes by speaking up and asking questions often. At City of Hope, there are many resources to help you learn more about chemotherapy and how to manage side effects. Your most important resource is your healthcare team. Remember, they're always available to answer your questions. Read the materials provided in your blue chemotherapy packets. In your blue packets, you will find important education to help you learn more about your treatment plan, possible side effects, and how you can manage them. Visit or call the Sherry and Les Biller Patient and Family Resource Center for support services and education. You will find educational materials, computers and wireless internet, support groups, educational classes, wellness programs, resources, information, support, and a place for rest and relaxation. Some of the classes available are yoga, breathing and meditation, music therapy, art therapy, nutrition and physical activity, support groups, and more, so be sure to pick up a new calendar each month. For appearance-related changes and support, visit or call the City of Hope Positive Image Center. Here you will find licensed cosmetologists that can provide head shaves, wig fitting, makeup and skincare techniques, mastectomy counseling, head wraps, hats, radiation relief cream, and nail polish. Also, you can attend a Look Good, Feel Better class sponsored by the American Cancer Society. The Positive Image Center is open Monday through Friday from 8 o'clock to 4:30 p.m. If you are visiting websites on the internet for information, make sure you are visiting credible sources. Here are a few recommended sites. Key points to remember. We have gone through a lot of information, but remember, we are here to guide you. Some key points to remember are: you can take an active role in managing symptoms when you are prepared with the right information and support. Know when to notify your doctor or the nursing triage call center if you are experiencing any side effects that cause you distress. Review your symptom management cards and chemotherapy packet before starting your treatment. You and your family are the most important part of the healthcare team. Always ask questions and tell us your concerns. Being a partner in your care is one of the best ways to get through your chemotherapy. To end this presentation, let's go through a few tips for what to bring to your chemotherapy appointments. Any medications you are taking, so we can review them with you. Always bring some comfort items, such as blankets and a small pillow. You are free to bring your own snacks and drinks. Some patients chew gum or hard candy during chemo. Also, bring some salty snacks, a sack lunch, and your favorite healthy beverage. Bring some personal items to help pass your time, such as books, a laptop, or mobile device. You can bring a family member or friend with you, but please keep in mind we may ask them to step out for certain safety reasons, and due to spacing and safety, we ask you to bring only one visitor. Plan to be at City of Hope for most of the day. You may have a lab appointment, then a doctor's visit before your treatment appointment. Thank you for taking an active role in your care.